Appointment is effective October 10th, 2024, and the appointee shall serve at the will and pleasure of the governor. Today in front of us, we do have Ms. Bradshaw. Welcome, Cindy. How you doing?
Thank you, Mr. Chairman.
How you doing today?
Absolutely.
Good. You've already been in the position for a good number of months, haven't you?
Officially since November.
Good. Why don't you give us tell us a little bit about yourself and some of your background?
So I'm originally from North Carolina.
And yeah, you'll have to really speak into the mic.
Hi. I'm originally from North Carolina, moved to Mississippi in 1997. I served in the private sector, working at Blue Cross and Blue Shield and United Healthcare for about 15 years before I moved to the state to work with the Department of Finance and Administration. Started there in 2012 and worked with the Office of Insurance, primarily managing the state and school employees' health insurance plan in the workers' comp program until April of 23, at which time Drew asked me if I would come over and work for the Division of Medicaid to manage eligibility and the unwinding process. And I did that until October when Drew left and the governor asked me to step in as executive director.
Okay, thank you. We've gone through your packet and there's from what Peer has reviewed, I think that in their report, the only things that they had that were outstanding, and I believe you've already taken care of these, and that was the surety bond and the oath.
Yes, sir.
And I believe members, if you don't have copies or if you need copies, Ms. Mercer's got those for you. Are there any questions of the staff or the committee? Senator McMahon.
Thank you, Mr. Chairman. This, Director, this goes more to maybe a philosophy about Medicaid. I'm concerned about some fraud that's taking place, or I believe it's taking place in Medicaid, not necessarily with providers, but recipients. What percentage of the cases do y'all review annually?
Did you say bribery?
No, fraud. I may have said bribery, I meant fraud.
Okay. Yes, sir. So we do have an Office of Program Integrity, and they do multiple things, one of which is we do have data analytics looking at claims to identify any fraud. And once those are discovered, oftentimes it could just be a provider mistake in the way they file claims. And so if that's the case, we recoup the money. If we can determine that it's truly a situation that we believe is fraud, we will turn it over to the Attorney General's office.
It's not just fraud in the vendors or the providers. It's fraud in some people taking Medicaid that are not really qualified for Medicaid. I want to know about that. I want to hear about how many cases a year y'all reviewing and if you what those outcomes are.
Yes, sir. And I don't have specifics on that today. I can circle back with you on that.
Okay.
But it is something that obviously we take seriously, and we have various resources in which we can verify the information that's provided on an application. We do have some limitations that have historically been in place that are mandates from CMS on certain things we have to just take an attestation on. For example, if one is pregnant, or whether they're married or not. And so we do have some limitations on how deeply we can investigate those things. I'm optimistic and somewhat encouraged that maybe we will be able to be more stringent in some of our resources under the new administration.
So when you say you're limited by CMS on what you can investigate?
Yes,
so they're setting the guidelines?
Yes, sir.
Okay. Thank you, Director.
Thank you.
Any other questions? Yes, Senator Boyd.
Thank you. And I appreciate the calls and the work that your office does when I call with questions and everything I've done so far to date. There's one thing I'm going to ask you to pay particular attention to that sometimes for agency heads, you look at your budget but I'm also going to ask you to look at the state budget as a whole. There are programs that we have done in this state that we are paying pure state dollars for when perhaps there was a Medicaid federal match. And so therefore, the overall budget of the state is dramatically increased when we could have gotten a federal match that would have been actually lowered all the budgets of the state. Now, what that does is it makes your budget slightly higher, but it also then lessens another state agency's budget greatly. And that's a difficult thing to ask agency heads and directors to do. But I'm going to ask you in those particular situations that we've been pointed to by those situations from a number of those agency heads to help us do that, to help us maximize that whole state budget. With that, because there are a number of programs, and I think we're going to have some changing CMS rules that are going to greatly change some of those things. But as you see those, can you help us make sure that the dollar you're looking out for is the taxpayer's dollar and just not your agency dollar? So
Yes,
that's
ma'am.
just going to be a request I'm going to ask.
We're actually already working on that. We've identified the possibility for school-based services to run those through. We are in the process of developing a request for proposals because we do need to have a system and an audit trail for that. That we hope to release that in the next coming months so that we can get a vendor in place to start managing that. We're also working with CPS. They have a lot of children that have been placed out of state. We've been working for a couple of months now with the list of providers that she uses out of state to get them into the Medicaid network for Mississippi, and also working with youth villages to try to help her a good bit. And so that is a big focus of ours already.
Thank you so much.
I've got a question more on the national level. What are you hearing right now from Washington about the Medicaid program and what might befall us in the near future?
The statements that, that I have heard is that the federal government's broke and that they are looking for ways to cut back. And I think they started with a very broad list of what all are the different paths that we have in which we could save some money. What we're hearing most likely is that I think that's the one that's the most palatable is that they're going to probably reduce the provider tax. And that has significant impacts to the provider community and to our budget.
I've also understand they may claw back or reduce the FMAP on the expansion states.
That is, yes, sir. That's one thing I can certainly say. I think the legislature and leadership was very wise to postpone the discussion about Medicaid expansion because I do think that's one of the things that's on the top of their list is to reduce the FMAP percentage for that. I've heard the president make the statement that it just doesn't make sense to pay a higher percentage for able-bodied working adults than it does for people who are not able to work. So I think that is certainly one proposal. We're also, watching closely. Currently, our federal match is 76.9%, and that's evaluated annually by CMS. And as the state does better economically, we run the risk of having that be reduced. So I think we don't think it's going to for next year, but as the economy in our state continues to grow, we have the possibility of that dropping back. And just 1% reduction in that FMAP equates to about $83 million for the state.
Well, your peer report came back clean. Any other comments from the committee?
Move we do.
I'll move for a motion then. Senator Boyd?
I move that we do advise and consent.
Motions we do advise and consent. All in favor? Aye. Those opposed? It'll be reported out. Thank you, Ms. Bradshaw, and congratulations.
Thank you.
This will go to the Senate floor and I don't see any problems with this getting passed. So, but thank you for your time. Rise and report.